next month. We have the health department reporting 14,200.
Kita po natin na starting October, mas may opportunity po tayo na ibaba pa further ang ating quarantine classification. So yan ang kailangan natin gawin alongside yung vaccination natin para mas mapabilis yung pagbukas natin ng ating ekonomiya.
Over 21 million Filipinos are fully vaccinated, and government has also approved the vaccination of kids against COVID-19. Will this help protect children in the full reopening of schools? We discuss in this episode of The Chiefs. Welcome to this Thursday edition of The Chiefs. I'm Ed Lingao, and also with us, Ana Marie Pamintuan of the Philippine Star, Lucy Cruz Valdez, the head of News 5, and Robbie Alampay of One News. Ladies and Robbie, well, happy Thursday.
Hello.
Happy Thursday.
Happy Thursday.
Isang araw na lang.
Oo nga.
Filing
Isang
ng COC.
araw na lang at
Filing ng
bukas.
COC.
Masaya na bukas. Oo.
Well, the circus starts, you might say.
masaya talaga.
Finally, ni-nominate na ng isang bayan si Vice President Leni Robredo, no?
Nominated but
Pero
not yet
Abi,
accepted.
ano ibig sabihin ng
Surprising ba yun?
nominate?
Oo nga eh.
Ibig sabihin ng nominate? Parang iba
Doors
yung...
lang.
Oo, di ba?
Pinangalanan lang, pinangalanan. Hindi
Yeah.
ba ina-accept? Hanggang ngayong gabi, naghihintay kami. Wala.
Although I was wondering about our interview last night with Howie Calleja, Attorney Howie Calleja, who was saying na
Yes.
they don't
Yes.
nominate until it's accepted by
They're
the
sure.
nominee.
Yeah.
Eh, bakit naganaw?
Kaya nga eh.
Diba? Bakit
So,
naganaw?
Yeah.
Oh,
I mean, frankly, honestly, and this is just my personal opinion, it looked awkward and it seemed awkward also for Leni Robredo because immediately after,
Yeah.
she was forced to, I think, she was compelled to come out with a statement that frankly makes her look indecisive even more.
Oo nga. Although, meron ding mga rumors na ang iniintay daw niya kung ano daw ang tatakbuhan ni Bongbong Marcos. Yun daw ang
Yeah.
tatakbuhan niya.
But
Okay.
I think, pero Ami, yun yung big question today. All of that is legit. Kung may rason pa siya not to decide, which again throws the question to isang bayan, then why did you have to hold that event today?
Oo nga, yun na nga. Saka may
So hindi yan playbook ha, tingin mo Robbie?
I don't
Hindi
know.
yan playbook na meron silang
ewan ko.
sinusunod na, I don't know,
Parang
meron
lahat na
ba
lang may playbook,
drama
no?
yan, meron ba? Hindi ko alam eh, I don't know how to read it frankly because
Hindi naman tayo nagpapanggap na political expert. But ako, frankly, as a Filipino citizen, kung playbook yan, hindi ko maintindihan yung play.
Although one little bit of detail, last I heard she's not in town. I'm talking about Leni Robredo. So if she doesn't come back to the NCR in the next 8 days, then that gives you an idea where she's filing her COC. If she is.
That's a good point.
Yes, that's
Kasi
true.
ang
Because
national-
if it's
yes,
a national
positions
position,
will have to
it
file
has
sa
to be
Sofitel.
filed here.
Oh,
Yes.
Yes, in Sofitel.
Ang regional at local positions will be filed sa provincial or municipal COMELEC offices.
Yes.
Pero
That's
Bok,
why-
balik ka naman, ano ibig sabihin nun na pagka yung local government official naman na naka-leave from October 5
Kaya
Yun
nga,
din.
that's
So,
why,
actually,
that's why
yeah,
even that is
interesting to
raising
look at the
eyebrows,
clues, eh.
diba? Because you're wondering where would she be? Well, that's something to watch out for.
Ayaw natin mag-political analyst,
Eh,
yun
di
ang
ba
ginagawa
ganyan din
natin.
yung nangyari nun? Ganyan din nangyari nun eh. Nung kay President Duterte, remember?
Okay.
Inabangan ng lahat. Tapos nag-Manila Hotel muna siya. I remember
Yeah,
that eh.
yeah,
Parang
yeah.
somebody spotted him at the Manila Hotel.
Hindi ka
But-
makasegue, ano.
But
Yung
we're not
COVID
saying anything, we are not saying anything definite. We're just looking at little bits of fact that we've picked up along the way. We're not saying that anybody is doing what.
Yeah.
Just to be sure. Yun.
So we're just saying this is what to watch out for.
Yeah, yeah.
Oh. At
Teka,
saka habang nagkakagulo ang politika, paano natin naayusin ang COVID?
Oh, yun!
Ayan,
Galing yung segue.
Ayan na, game na.
Kaya na yung segue.
Grabe yung segue naman yan. Hindi man lang suwabe. Okay, sige. We begin tonight with Dr. Jose De Grano, the president of the Private Hospitals Association of the Philippines. Dr. De Grano, thank you for joining us and welcome back to the Chiefs.
Hi, good evening,
Evening,
everybody.
Dr.
Good evening, sir.
Yes, Doc.
Good evening.
Of course, you have heard, I'm sure, of the growing calls to downgrade yung alert levels, at least sa Metro Manila, from alert level 4 to perhaps alert level 3. But I was looking at the statistics ng DOH, at least today, ICU beds throughout the country, 74%. ICU beds in NCR, 75%. Isolation beds in NCR, 53%. Ward beds, 64%. Ventilators, 57%. Utilization. How does that look to you? Does that seem to you reasonable? Are these reasonable numbers for us to downgrade?
Well, if you will note, yung mild and asymptomatic went down. Dati yan more than 95 or 96.
Oh, yes.
Kasi
No.
yung mga mild, severe, and critical were less than or around 5. No? Ngayon, tumaas sila. Kasi 93% na ang asymptomatic and mild. So, ibig sabihin, yung mga serious, mild, severe, and moderate cases are increasing. So actually, yung mga number of beds, if you will note, sabihin nila mga 75% ang occupancy or even the ICU. But when you go to the hospitals, even the private hospitals, they will say that the hospital is full already. Why? Because there are only a few healthcare workers working right now. Ibig sabihin, kulang talaga ang healthcare workers for the past 2 or 3 weeks. Why? Kasi some have resigned. Some are planning to go or apply overseas. Some have, actually, nagpahinga talaga yung iba. They are too tired already. I mean, working 8 hours to 12 hours, even 16 hours. So they have to take a rest for at least 2-3 weeks, even a month. And some, of course, have transferred to government facilities. Yun ang problem right now ng mga private hospitals. And also, yung aming mga doctors, aming mga alliance of health professionals, they are recommending na we stay at level 4, not to downgrade yet, because they think na medyo maaga pa. It's too early to know. If you know, itong ating down, parang nagda-downtrend tayo right now. Epekto pa ito ng MECQ and ECQ that was a month ago. So ito pa yung effect after that. Ngayon, nagkaroon tayo ng 2 weeks na level 4. We should see the effect of that in the siguro first 2 weeks of October pa.
Doc, bago natin
So,
iwan,
Doc, another
yung binigyan
thing
po
that
ninyo kasi
they're-
yung mild bumababa at yung severe at yung critical tumataas. I'd like to go back to that.
Diba? From 5% yan, ngayon almost 7% na ang moderate, severe, and critical. So, ibig sabihin, tumadami yung especially yung critical. Baka mas dumami, at least 1%. Before, that is really less than 1%.
But shouldn't the vaccinations have addressed that issue? Hindi ba?
Yes, bakit po kaya?
Medyo. But then, if you know, talaga namang yung statistics show na around 70% of those confined at the ICU or critical cases are unvaccinated.
Vaccinated.
Okay. So, sir, it has nothing to do with the question of whether or not all of these cases are in NCR or outside of NCR.
We should expect less from NCR because we are supposed to be 72% vaccinated here in NCR, and the rest of the country, the highest is 25% lang ang vaccination.
In the meantime po, meron talagang dissonance between yung sinasabi sa hospitals na puno na naman kami, and on the other hand, yung nakikita nating bumababa yung numbers. One of the things that everybody's saying is, kaya parang magkalis yan dahil pati yung testing bumababa, pati yung testing limited. So that is to suggest, and your experience seems to suggest it also, na actually mas mataas talaga dapat ang numbers.
Yes, yung nakita natin ng lower numbers, di ba? Pero still high, 13,000 ang lowest ko nakita for the past week, Pero still ngayon, tumataas na naman, we have not gone below yung level natin na in February and March na around 2,000, 3,000, 4,000. Never for the past how many months since March na bumaba tayo ng ganung level. Wala eh, hindi tayo bumaba.
Doctor, I'm also curious yung sinabi nyo na for the past 2 or 3 weeks nawawalan pa rin kayo ng health personnel. Akala ko inaasikaso na yun ng government. And that coincides with the start of the pilot ng granular lockdowns and new alert level system. You're saying na nung nag-pilot actually nawalan pa kayo lalo ng mga healthcare workers?
A lot of our nurses talaga nag-resign, They are planning to apply for overseas jobs, A lot of them. Siguro around 5% of the present after the second surge. So medyo even the big hospitals sinabi nila na talagang yung decrease in number of healthcare workers nila, not because they are really sick, but a lot of them were resigned because they are planning to go abroad. So, yes, that
Okay.
happens not only in Manila, also in other areas of the country.
Okay, balik ko lang po dun sa R0 at saka positivity rate, no? Are you saying though that even in Metro Manila, you don't see the trend going down and you don't see a possibility of a loosening of quarantine, even just in the NCR, at least within the next, let's just say, a week or two?
Yes, as I was saying, what we are seeing right now, yung downtrend, is supposed to be an effect of the MECQ for the past 2 weeks. And then, that the level 4 is more relaxed than the MECQ. Mas maraming commercial establishments na open itong level 4. And we will see the effect of the level 4 in the next 2 weeks pa.
Yes, okay. But we also know that they're saying at least that the vaccination rate in Metro Manila, in the NCR, is now hitting 65%, no? Or at least that's where it's headed. Doesn't that bode well at least for a loosening of quarantine?
Yeah, talagang actually nga, ang report ng Department of Health, they have reached 72% na vaccination dito sa Metro Manila.
Ganun na pala kataas. So, yun ba? Pwede na po ba yun? Do you think that's justified already? A lowering of the alert level to alert level 3?
Our healthcare professionals do not think so. Because sila yun nandun sa hospitals. They can feel na tumataas pa rin ang cases. Na it's not really going down. Kahit nga...
In the NCR?
Yes, the NCR. That's what they are saying. Even our doctors from the NCR are saying that.
Doc, you made note kasi of, well, you're saying kanina na yung effect ng downgrade to alert level 4, I know it sounds funny, no, pero downgrade nga siya, to alert level 4 will only be felt in the coming weeks. So you're looking at, what you're saying is that you're looking at the possibility of numbers increasing pa in the next few weeks.
Yes, because level 4 is, as I said, is more relaxed than the MECQ. So ibig sabihin na more exposure for the people. So ibig sabihin baka by the next 2 weeks, we will feel na the effect of the level 4. And then if we're not prepared for that, it may even go up again. The trend will even go up or plateau in the next coming weeks. So what they are saying, yung aming mga health professionals is, let's maintain it to level 4 first, for the next 2 weeks. And then we'll see. If there is really a downward trend after that, after 2 weeks or maybe 3 weeks, then siguro we can proceed to the more opening up like level 3.
What about in the provinces? Sige, go ahead.
Go ahead, Lucy. Dala ka ba? Baka malihis ako eh.
Okay, yun lang. Tatanong ko lang. So, is it better in the provinces as far as private hospitals are concerned? Or, yeah.
No, it's getting worse actually in Region 3, Region 4. the northern part of Luzon, in the Cordillera, CAR, and also in some parts of Visayas and Mindanao. Even in Zamboanga, they are reporting another increase in the number of cases.
So pati health workers nyo ron, ano rin, nababawasan din, kulang na rin.
Yes,
So,
that's a problem. It's all over the Philippines. The problem of decreasing number of healthcare workers is all over the country.
Nagre-request ba kayo ng dagdag na restriction sa deployment? Kasi ang New York City nag-announce na yung
Yes.
governor na they will welcome healthcare workers from all over the planet and including of course the Philippines.
Yes.
Siyempre,
Yes.
maraming gustong magtrabaho dyan. Are you asking the government na medyo higpitan ng konti yung policy?
Well, actually, not really directly asking them, but siguro they should, at least naman, they should know what will be happening right now. The other government agencies are trying to help us. Supposedly, the Bureau of Fire, they contributed 127 of their nurses to private hospitals recently. So I don't know with the Department of Labor, if they are really encouraging our nurses to go out and then maybe go again to New York City now. And even probably the doctors, because they are not specifying nurses only. All
Healthcare
workers.
Yes.
That includes doctors also. So, that will deplete all our manpower resources in our country.
Doc, now I think this makes my next question more relevant. Speaking of government agencies and your relations with them and them hopefully helping you, kamusta naman po ang hospitals natin with relation to PhilHealth?
Yes. Actually, wala pa rin, For the past month, that's the end of August when we presented to them our position paper. Until this date, walang concrete solution na present sila when we have presented to them point by point kung ano yung kailangan namin. That's why even a group of hospitals, if you will note, a group of hospitals in Iloilo have really threatened to not to renew their accreditation by next year if they are not paid by end of October. And
but nobody has been investigated yet, diba? Remember, there was a threat coming from PhilHealth, that memo na they're going to start investigating if you don't submit the document. Meron na bang na-investigahan o na-memohan?
Doon sa mga supposedly fraudulent claims, I think they have filed some fraudulent claims. But yung hospitals po, especially dun sa Iloilo, what they're asking is for the payment for their around 545 million of reimbursements for the 7 big hospitals in Iloilo. And they even submitted this to the local government units, to the governor and the mayor of Iloilo City, and they are siding with the hospitals. And I don't know, tomorrow we'll be having a meeting with ARTA regarding this claim of the Iloilo Hospital.
Anti-red tape. But in the meantime, Doc, para lang po malinaw, that circular, that controversial circular na pumutok last month,
Yes.
it still stands?
It is suspended for implementation, not yet implemented.
So ano po yung laman ng point? You said you sent them a point by point petition yan or ano yung laman po nun?
Ang laman ng aming mga point by point is dalawang klase yun. First is yung payment of claims. Now we're giving them until end of October to pay if it's true that they owe us 21.1 billion, then at least they should pay us the 21.1 billion. But then the other terms is not really that easy to do. It involves different circulars that has to be talked about at the level of the board of PhilHealth, and that can also be done by issuing other circulars.
So pag hindi nila ginawa yon, anong gagawin nyo? Hindi nila binayaran.
Unfortunately, the decision will be before the end of December, whether our hospitals will really no longer accredit themselves from the from the PhilHealth, and that's really unfortunate for most of our people because
Yes.
yung process nila will be longer, instead of directly deducting the benefits of our PhilHealth members, they will have to go and pay first and then refund their benefits from the PhilHealth offices.
So mag-out of pocket muna sila, tapos
Yes.
papa-reimburse na lang.
Yun ang mangyayari if most of the hospitals will not accredit themselves from PhilHealth. Yun.
Kumusta na po yung deployment ng military and police medical personnel sa hospitals? Kumusta na yung progress nun?
Yeah, sabi nila meron na eh. What I heard only are from the Bureau of Fire, Pero yung sa military na wala pa kaming nakita na talagang nag-deploy sila sa mga different private hospitals. I don't know about the government hospitals. Baka sa government muna sila nag-start. We don't know about that.
So mga ilan lang yung na-deploy na yun as far as you know, yung from BFP?
As far as BFP, they said they have already deployed 127 of their nurses who are probably they are not really working as nurses in the Bureau of Fire, baka firemen or firewomen, but they are qualified as nurses. So, yun, dinideploy nila sa different private hospitals and also government facilities.
Doc, balikan ko lang po yung 21.1 billion with PhilHealth kasi parang isang taon na po natin napag-uusapan to eh. Every time we talk about it, akala ko mareresolve man eh.
Mula ng pandemic.
So I'll go back to that eh. Saan po ang problema? I mean, we talk to you, we talk to PhilHealth, and everybody says it's going to be resolved or it's on the way to be resolved, and then we have a cycle all over again. Where is the glitch?
I don't know why they cannot reimburse us that amount. Actually, that amount, it came from them, Yung 21.1 billion, sa kanila galing yun, They say they owe us 21.1 billion. These are supposedly in-process claims, And then, yun, sinabi nila, they are going to do something about it and they will release this through a DCPM. But most of the hospitals, debit credit payment method, most of the hospitals do not want or do not agree with the DCPM terms and undertaking. So, medyo konti lang yung kumuha ng mga DCPM na yan because ibibigay sa inyo 60% lang muna and then i-hold nila the rest of the 40%. And then yung napabigay sa inyo na 60%, pwede pa rin ulit nilang bawiin. Which is, I don't know kung bakit gano'n.
Okay, well, we hope it gets resolved kasi kung sakali po, ang deadline niyo po is end of October, no?
Yes. Most of the hospitals. At saka itong sinabi nila na ng Iloilo group of hospitals, talagang sinabi nila, they do not want to talk with PhilHealth unless they have concrete solutions to what they are telling them. Ngayon, kung walang sagot daw na maayos, huwag na lang makipag-usap sa kanila.
What is the likelihood na pag tinuloy nila yon that many others will follow suit?
Well, of course, yun nga. Some hospitals in the north are already planning to do the same. Yes, and siguro yung ibang areas sa Mindanao also. Ganun din.
So parang test case sila, ha?
Yes. Ano nga itong mga to. Sabi nga naman, ang tatapang talaga na itong mga Ilonggo na to.
Ilonggo.
Yes.
Mga away talaga. Pero malambing. Sige.
Malambing naman.
Malambing mga away.
Malambing sila. Pero they were united and they were definite in their in what they are saying. So, yun.
Okay. Dr. Jose De Grano, ang Pangulo po ng Private Hospitals Association of the Philippines. Maraming salamat for joining us tonight. Ingat po.
Thank you po.
Thank you, Dr.
Salamat po,
Degrano.
sir. Ingat po kayo.
Yes, I'll see you again later.
We'll just go into a break, so please stay with us. Welcome back to the Chiefs here on One News, and now joining us is Dr. Ronjin Solante, a member of the Vaccine Expert Panel, also the head of the Adult Infectious Diseases and Tropical Medicine Unit of San Lazaro Hospital. Doc Ronjin, maraming salamat for joining us again, and welcome back to the Chiefs.
Hi, good
Good
evening.
evening, Doctor.
Hi, Doc. Doc, well, we were just talking to Dr. De Grano, yung Private Hospitals Association, and may binanggit siya, we'd like to confirm with you yung numbers niyo. Kasi sabi ni Dr. De Grano, napansin nila na bumababa yung mild cases, tumataas yung yung critical, severe, moderate. Are you seeing the same thing? We want to talk about vaccines, pero coming from Dr. Ronjin, I figured I'd ask you first. Are you seeing anything to that effect?
I cannot comment on the mild, no? Kasi ang na-admit sa mga hospitals namin, kaya ng San Lazaro Hospital and the other private hospitals, are really the severe and critical. Kaya talagang more on bias talaga ang data natin dahil hindi naman magpapa-admit yan kung hindi severe critical, no? And alam mo naman ngayon, napakamahal ng magpa-hospital. So siguro yung mga considerations ng mild at moderate hanggang sa mga bahay na lang muna. And that is the experience now, no? Hindi mo na dinadala nila sa mga hospital until such time na talagang kailangan na yung oxygen, kailangan na yung mga life support, doon pa lang nila dinadala.
I think his reference was yung nilalabas ng DOH na daily figures, yung percentages ng mild versus yung critical, severe, moderate. That's why we just thought of asking you first, kasi baka you might have something along those lines.
Yeah. So in terms of proportion, no, we have observed for this particular surge of the surge, no, this August to September. In fact, our ICU capacity never been naging 200%. Ibig sabihin, lumampas kami doon sa capacity namin ng ICU, and we have to make the other rooms like an ICU setup kasi marami talaga ang severe critical during this surge compared to the previous surge.
Ay, Doc, linawin ko lang po yun. You said never been 200%. Ibig sabihin, humampas kayo ng 200%?
Yeah, ang ano namin, Romy, no, is ang ICU capacity namin is like 54. But we are meeting like 104, 105 severe critical.
And that's not just in terms of opening up new units. I mean, that you actually have the manpower to deal with that?
Talagang napag-usapan na yan na when our capacity was increased from 100 to 150 plus, no? So napag-usapan na yan sa administration na we really have to put people there, no? So lahat yung mga areas na less ang admission, so ilalagay namin sila doon sa mga areas na mataas ang admission para lang at least we can cater yung needs ng mga pasyente. You can imagine in one room we have 4 or even 5 na naka-high flow nasal, no? In one room we have 2 or even 3 na naka-mechanical ventilator. So that's how bad this surge is when we had this during the time that our ICU capacity was really full.
Pero sa ngayon,
Okay,
kasi
so but
doktor,
are you feeling the R not going down and the positivity rate going down? Is that something that's reflected in your admissions?
Okay, this is the truth, no? In fact, hindi na kami tumitingin sa mga bumababa ba yung R naught or bumababa ba yung number of cases per day or yung positivity rate. Kasi until now, no? Kung titingnan mo, even sa mga private hospitals, ang hirap pa rin pupunta ng ER. Nakapila ka pa rin. Ang hirap pumunta pa rin ng makakuha ka ng rooms. And it's really a struggle, especially for those patients na mga critical. They really have to find ways na makapasok sila sa mga hospital ngayon.
So in the meantime, marami nagre-recommenda ngayon na mag-base na daw to alert level 3. And meron pa rin isang recommendation na across all alert levels daw, pabayaan na daw buksan ng mga businesses. Basta lang may capacity lang na i-step. Ano po yung tingin niyo doon? Kasi ang sabi ni Dr. De Grano, ang gusto daw ng hospitals, kung maaari, mga 2 weeks pa yung alert level 4. Ano po sa inyo kung paano?
3, you mean? Yeah.
Yeah.
Oo. Actually, being in a government hospital, no, wala talaga tayong magawa dyan. No? Gugustuhin man natin na mag-break tayo, no? But I think the focus now of the government is really to open up the economy so that by the last quarter of the month na medyo makabawi-bawi naman tayo, no? And here in the healthcare setting talagang very difficult for us. Pero wala eh. We have gone through the worst of the pandemic during the August and the middle of September surge na napakataas noon, no? And we continue to have those cases until now. So siguro we hopefully na talagang magda-die down ang number of cases because of the health protocols and the other. More importantly, the vaccine, no? which can really be an important moving forward to lessening the number of cases.
Yes, Doc. Doc, I'm trying to reconcile the numbers, the apparently positive numbers or optimistic numbers we are seeing from DOH every day. Kasi the numbers do look like they're getting better eh. Medyo bumababa na yung daily cases, bumababa na yung positivity rate and all that. Ngayon, 14,000 tayo. Before, we were hitting 24,000 new cases. I'm trying to reconcile that with yung reports from the ground. Like, for example, what you're saying na ay siksikan pa rin sa ER, ang ICU, siksikan pa rin. How do we, is there a problem with the lag time of the reportage or what? Parang hindi siya nagtutugma.
Yeah, yun nga, hindi ko rin masagot yung question na yan. Okay, let's get this. Some of our admissions are not from NCR. Okay,
Opo.
They're from as far as Bulacan, Laguna, Cavite. No, so probably siguro 50% lang ang NCR, but the other 50% there are coming from outside of the NCR. So that's the problem.
May iniimbestigahan din daw ang DOH ngayon na nagtataka daw sila kung bakit bumabagsak yung mga testing. Would that have anything to do kaya with anong tingin niyo doon? Are you experiencing that as well? Are you getting those reports?
So far, wala akong I am not so privy about bumaba yung testing, no? But
Kaya
all
daw
I can say,
yung cases. Kaya daw bumababa yung cases, bumababa yung testing, hindi nila alam kung bakit. Kaya yung hospital overwhelmed pa rin. Pero actually, yung numbers bumababa, hindi malaman kung anong.
or probably it's more of a lag lang siguro, no? Na yung mga nag-positive ngayon, like may delay in the reporting. Siguro yun yung nakita ko lang dito because hindi naman talaga nagiging real time ang reporting natin, no? So that delay could have been the reason why in the ground we are still having cases, but in terms of the numbers, it's decreasing. But hopefully, no, makikita natin yung pagbaba talaga ng kaso, and that's what we're hoping for.
In the meantime, Doc, all things considered, where does this put you in terms of itong usapin on whether or not to step down sa alert level?
Personally, if if the projection of the government is more on opening up the economy so that we can recover, I'm for that, no? As long as siguro paigtingin din natin ang vaccination. We can take care of the healthcare facility, we can take care of the patient as long as there is government support, there is admin support. Yun lang naman ang palagi naming hinahanap dito, no? And hopefully we'll be getting all the necessary support, sustainability ng mga gamot, ng mga life support system, including those mga drugs that are really important in the management of COVID.
Pero Doc, those are
And
big
you frame
ifs,
that bilang isang panawagan, no? But based on what you know, what you've seen, what is being reported, iigting ba ang vaccine situation natin?
I think there is some hope of more vaccines coming in, no? And hopefully mapataas pa rin natin ang vaccination rate natin, because talagang yung limited supply ng bakuna, Robin, no, this is not only unique in the Philippines, no. I just came from a meeting with some Asian experts. Talagang lahat ng bansa sa Asia are talagang namumblema sa supply ng bakuna. And this is not unique to the Philippines, and that's why also most of these countries are still experiencing surge of cases. Yung health capacity rin pa rin nila are also challenged, just like the Philippines. And all of us are still hoping na by next year, magtaas na yung mga bakuna na supply. There are new vaccines coming, no? Mga bagong bakunang maganda ang data sa trial, and I hope this will also be available for next year or early part of or last quarter of this year.
Yeah. Doc, yung vaccines nga are not within our control, pero there is something that you mentioned that should be within our control, which is yung resources being made available to you, and that was a major point from what you said. Na if you're given enough support and resources and all that, does it look that way? Kasi for example, lumabas sa hearing kapon sa House, in the 8th month of the year, nasa 32% pa lang ang disbursement, or 38% pa lang disbursement ang DOH. And last year, mayroong mga almost 60 billion na hindi nagamit ng DOH budget. And going further back, mga almost 40 billion na hindi nagamit for 2019 naman.
Yeah, so far speaking for the hospital like San Lazaro, no, medyo naman naibigay naman yung mga request namin, no, availability ng drugs, including yung mga high flow nasal machines, no, and we doesn't have much difficulty in those, no. Probably yung may mga konting supply lang siguro na kulang, but it's more of an internal problem rather than a national problem that it's not supporting our hospital.
Doc, nabanggit nyo kanina, meron din mga bali-balita na, as you said, promising new methods, new types of vaccines being developed. Let's just remind everyone, you are a member of the vaccine expert panel. Give us some idea. What are some things on the horizon that have you excited?
Okay, may mga bagong bakuna ngayon, no, na katatapos lang nila ng phase 3 trials nila, no? And I think you've heard that in some news, itong mga subunit vaccines, okay? There is one coming from China, there's one also coming from the US, okay? So hopefully, these vaccines will also be available aside from the current vaccines na nakikita natin at ginagamit natin. It's really more on the supply of these vaccines that are very limited because all countries are needing this. And if we have additional 2 or even 3 new vaccines that are available, then that can be a big boost also to our vaccination rollout.
Are you following the developments with Merck? They are developing the oral vaccine. Medyo advanced na yung
Monorural, yes.
not, di ba? Oo.
So I think meron naman silang but these are mga prophylactic mga treatment, no? Not really our vaccines.
Oral, kala ko oral vaccine yun, in towards with the variants.
No, it's a treatment. Yung alam ko, prophylactic treatment nga.
Prophylactic treatment siya. I mean, like, if you are exposed, you will be taking that medication for how many days, and then that will decrease your...
Early stage, early stage.
Right.
Early stage.
Doc, what about your appeal to give boosters to health workers? Has that been addressed? I mean, have they considered that?
Ang sagot ko na lang dyan, Ma'am Lucy, no? I think we'll have to wait for what's the decision of the Department of Health, no? But I think in the context na limitado ang supply natin, ang magiging ano pa rin, objective and goal natin is to vaccinate all that are or that has not been given the vaccines yet.
Yeah. But how does this affect your health workforce? Kasi that was your concern then, eh, di ba? And in fact, I recall that si Dr. Jonas Del Rosario, when he was with us, he even sounded out a call for doctors to volunteer or to at least, apply to work with PGH. So there was a shortage back then. I'm wondering if the shortage is still, acutely felt now.
I think malaki naman ang tiwala pa rin ng mga healthcare workers sa bakuna na natatanggap nila, no? And we're waiting kung ano man yung recommendation ng government to give the booster. We will be waiting for that.
Kumusta yung health workers nyo sa San Lazaro, Doctor? Kasi sabi ni Dr. De Grano, tuloy-tuloy daw yung pag-alis pa rin ng mga healthcare workers nila. And may napunta ba sa inyo na yung mga i-deploy daw na military sa police, medical workers?
So far, amin, no, wala pang ganong mga na dumating sa amin. But we are also affected by healthcare workers, especially the nurses, no, yung pumunta ng abroad, no, UK, Middle East, ang taas kasi ng hiring nila ngayon doon. So wala tayong magagawa doon kasi mataas ang pay nila at saka maganda ang mga benefits, no. Talagang we cannot really compete with those mga bansa na kailangan ng mga nurses also.
Doc, as
What
if
about the
hindi...
death rate, Doc? Is the death rate at least slowing down? Although we just recently broke 38,000 nga raw, di ba? But there was a day very recently when there were 0 deaths. Although, of course, they were saying that there was a technical glitch or something. But on the ground, in the hospitals, kayo po ba nakakaranas ng mas maraming deaths ngayon? Or are you getting more, sabihin na lang natin, no? Are you getting more used to the patients that are coming in and in a way have upped their game, meaning you've developed a level of expertise in the critical care that you give?
Yeah, isa yan sa mga nakuha nating technical skill, no? Yung competency natin tumaas kumpara last year, no? Yung anticipation, how to detect those mga pasyente na will go into severe when they are in the hospital, anticipation sa mga complications. But again, based on the data we have, no? Nung tumaas ang kaso, tumaas ang ICU occupancy, tumaas din ang mortality. Expected naman yan eh. Kasi kung tumaas ang severe critical, then chances are, medyo marami-rami rin ang death.
Doc, as if hindi pa tayo kulang sa mga dilemma. We know we've been pitting public health and the economy for a long time. Pero ngayon, election na. We just opened, I think, another can of worms pagdating sa granular lockdown. Anong gagawin kung naka-granular lockdown ka? But I just wanted to know, yung perspective nyo, how would you frame the perspective of an infectious disease expert such as yourself? Pagka pinag-usapan natin, ano nga ang gagawin natin on day of elections, tapos may mga naka-granular lockdown, what is your perspective, sir? Anong idadagdag nyo sa usapan doon as reminder?
Alam mo, Robin, no, ang pinaka-importante, ang kinakatakutan namin sa election, na when our vaccination rate are still low, there will be surge of cases because I know election can be a super spreader event. Ang tao, pag sinasabing bumuboto yan, grabe naman ang natin dito sa election, no? And that will really be an important observation. Hopefully, by that time, sana, no, marami-rami na ang mabakunahan so that we can have some complacency, no? Not necessarily complacency, but we can have a relaxed quarantine procedure. Kasi alam mo, malaking bagay ang election sa Pilipinas, no? Napakataas nung rate na pumupunta sa mga precinct. And when you are holding an election na isang araw lang, tapos pupunta lahat ng mga tao doon, that's really something, a super spreader event.
Kasi this really reminds us of what happened to India. But I don't know how closely we're monitoring that. But you say India, clearly the political exercises heading into the elections, yung mga rally, yung mga campaigns, that really contributed to it. But are there lessons to be learned, if any, from the actual conduct of the voting, not just in India but in elections past over COVID?
Yeah, I think the COMELEC now, the government should really have a plan now on how to conduct these elections, how to conduct these mga rallies. No, there should be health protocol measures that should be in line with our current health protocols when we will be conducting mga gatherings such as rallies, such as voting. So I think napaka-importante niyan, no? And we're hoping na sana walang mangyaring ganun na tataas ang mga kaso.
But Doc, just to complicate things a bit more, by the time elections roll around next year, baka paso na yung mga nabakunahan this March and April. So that might be time naman for booster shots, if at all. And I don't know if you already planned for that. I'm sorry for complicating things, pero di ba? By that time, may ano na eh.
6 months eh.
Alam mo Ed, tamang-tama yung observation mo, no? And in fact, napag-usapan din namin yan na by that time, yung mga nabakunahan ng March, April, talagang mataas na rin ang maging breakthrough infection on that, no? And I think in one of the meetings I have with some of these Asian experts, I think most Asian countries now are really on the projection of giving boosters to selected population like immunocompromised, elderly. There are already countries giving boosters to healthcare workers. And those are some of the directions that some of these countries are preparing for next year's vaccination program.
So kahit tumaas yung vaccination natin in NCR and nationwide, you still want restrictions imposed. Kasi especially with Delta, with the variants, dami-dami talagang breakthrough infections, di ba?
Yes, importante pa rin ang restriction, no? And in fact, ang isa sa mga nakita ko dito, bakit kung bababa man yung mga kaso natin, vital ang restriction at saka yung mga health protocols.
Doc, just to remind us again, I mean, not to make anybody overly concerned or panic, we have to stress that data is still coming in with regards to the need for booster shots. Effective pa rin po ang bakuna, first and second shots, and so on and so forth. But dito sa usapin ng booster shots and whether or not we're gonna need it, how should I be doing the math in my mind? Let's say I know the date of my second shot. Ilang buwan ba bibilangin ko before I actually start thinking, hey, this is a legitimate question for myself?
Okay. In other countries, the month that binibilang nila ngayon is the 6 to 8 months after you receive your second dose. So, ibig sabihin, kung nagpabakuna ka ng March, April, May, June, July, August, September, you're already a candidate for getting the third dose. No, in some countries, no, like the experience in Israel, in some South American countries, and some Asian countries, no, but only on a selected population, not for the general population.
Doc, are we already planning? I know this is way ahead pa eh. We're still looking at vaccinating majority of the population. We're not yet there. But are we already planning for next year's budget, next year's supply, next year's order of booster shots?
I think the government is already planning for that, no? And isa yan sa mga siguro usapin in terms of procurement for next year. And hopefully that will materialize and that will also be part of the plan, aside from vaccinating those that has not been given the vaccine yet.
At sana naman mas marami ng available na vaccine from other countries, no, especially from the originating or the manufacturers mismo.
Or sana we have na manufacturing here.
I think this is the ongoing appeal, even in the United Nations. Well, President Duterte himself said that. And then the World Health Organization as well has been appealing to the richer countries to diba, release volumes for poorer countries. I hope by then. But, this is a reminder to you, Robbie, that your booster shot is up.
Doctor, yung
Si
pediatric,
Robbie hindi
Grabe
pwede pa
kasi
si Robbie.
maaga nagpa-vaccine yan eh.
Hindi.
Oo nga, pero
Healthy.
hindi ka immunocompromised
Oo,
tsaka
hindi
ka senior.
immunocompromise si Robbie. So, okay ka pa doon.
Hindi pa po. Binabantayan ko nga po yung balita na pwede na raw sa mga 15 years old and below.
Di ba senior citizen ka na?
Doctor,
Hindi
yung
ba?
pag-umpisa yung pediatric vaccination, any words of caution from you dyan sa pag-roll out ng pediatric adolescent vaccination?
I think that's part of the government's plan, no, na
Yes.
to really vaccinate everyone, no.
October.
So ang crucial lang diyan is the consent from the mother, no, kasi hindi ka naman magpapabakuna, hindi mo pwedeng bakunahan kung walang consent ng mother. And I hope ma-address pa rin yung mga hesitancy
Yes.
sa mga bata. Alam naman natin yung mga na-experience natin in previous years kung bakit bumaba ang vaccination rate sa mga bata, no? And I hope this time, if ever the vaccines will be given to this 12 to 15 and 12 to 17, sana kung i-offer ng government yan, mataas ang vaccine acceptance dito sa mga population ito.
Sana nakalimutan na yung Dengvaxia experience by then, no? I think that's the, yeah.
But ito, dito kasi, binalita namin kanina sa big story. I think it's pretty significant. And maybe, sir, if you could respond to it also. Speaking of hesitancy, YouTube just came out with a policy they will be taking down and they will be banning anti-vaccine material from all of YouTube, which I think is pretty significant. Do you think social media has played a big role here, and how would you see this kind of news?
Yeah, I think even with the Dengvaxia issue, no, ang taas ng impact ng social media and maraming nagpo-post ng mga unfounded evidence na itong bakuna nakakaganito or nakakaganyan, no? And that has also been happening to us, no, in the Philippines when we are having this COVID-19 vaccine. It's a good news, no, kung ang YouTube tatanggalin yung mga anti-vaxxers, ay malaking impact yan kasi doon nag-uumpisa sa mga social media ang mga unfounded evidence against vaccines, no? And ganito yan, Roby, no? Even adults now, these are my experience sa ground. Yung mga matatanda na na-admit sa mga hospitals namin, walang mga bakuna. Kung tatanungin mo, bakit sila hindi nagpapabakuna? Some of the reasons, may hinihintay na preferred na bakuna. Yung iba naman, hindi naniniwala sa bakuna. Natatakot, no? So I think these are the important aspect why some of these are vaccinated elderly that should be the priority na hindi napapabakuna.
Doc,
But you're expecting higher hesitancy among children, di ba? Usually, dyan yung pinakamataas, nag-aalala yung mga magulang. Are you
Yeah, sana Ami, ano na lang tayo, cross our fingers.
But you will launch an intensified information campaign once it rolls out.
Yeah, I think the DOH has already prepared for that. No, kung halimbawa i-roll out na at saka pwede nang mabakunahan ang mga bata, that should be one of the priorities. So how to convince the mother, kasi ang mother ang very crucial doon sa ganitong stage of vaccination.
Doc, I think the last time you were here, I was desperately asking you for good news about Christmas, and I think you gave us a bright prognosis naman for Christmas. Eh. Do you still see the same thing? Are we looking at a brighter Christmas, or has it changed? Matatawa kayo.
Ang sinabi ko noon, na baka by Christmas, kung hindi natin mabot yung herd immunity, baka until Christmas, baka mag-general community quarantine pa tayo, no? Just to make sure na ma-lessen ang hawaan natin, no? But hopefully, no, tingnan natin by this October kung talagang bababa yan. And I hope it will. Medyo maganda-ganda ang magiging Christmas natin. And I think it should be anchored again, no? Ang napaka-importante yung kung maraming mabakunahan before Christmas.
Okay na muna yan, Ed. Happy na ako doon. Kinakabahan ako sa mga pahabol na tanong ni Ed, eh.
Baka magbago pa yung ihip eh. Sige, bitawan natin si Doc.
Good news, we can on a good note.
Doc, maraming salamat for joining us tonight. At ingat po parate. Always good to have you on the
Thank
show.
you.
Salamat,
Thank you.
Doc.
Thank you.
Doc,
Bye-bye.
Thank you, Doc Ronjin.
Thank you.
And that's all for this Thursday edition of the Chiefs. We hope what to discuss here will keep the conversation going. Now, before we go, a reminder to our viewers, mask on, wash hands, and stay safe, Philippines. I'm Ed Lingao.
I'm Ami Paminton of the Philippine Star.
I'm Lucy Cruz Valdez of News 5.
I'm Robbie Alampay, and we are One News.